exciting opportunity. Good morning, everyone. It's another exciting opportunity to gather here this morning. We are glad to have you join this meeting. In today's webinar, as announced earlier, it's titled How to Craft a Program or Project Abstract for a Scientific Conference. And I'm sure that based on last week's conversation, we had a couple of useful tips to guide our abstract writing going forward. Our expert, Dr. Olayinka Stephen-Ilesomi, is present here to teach us further. But before we proceed, we'll be setting a few ground rules. Firstly, we would appreciate it if all participants are muted. Please, as we join the meeting or as we rejoin, in case we have internet flickering, let's set our microphones to be muted. We'll be taking a Q&A session after the presentation, and at that point, participants would be permitted or accommodated to unmute themselves. If at any point during the presentation you would like to ask questions so that you do not forget, you could either take note of them so that you could use the hand raise icon after the presentation, or you could send them in as the presentation proceeds. And with this, I hereby welcome us all to this session. Please have an amazing time. Dr. Ilesomi, over to you.
Yeah, thank you very much. I hope I'm audible, moderator.
Yes, you are, sir.
Okay, good morning, everyone. Good morning, colleagues. I'm glad to be here again this morning. And today, as announced, we'll be talking about how to write program projects abstracts for a scientific conference. So this is the outline that I'll be using. I'll be talking about the objectives of this section. I'll be introducing or telling us about how to write the introduction and the background. We'll have a talk on the description also, the findings, the conclusion, and we'll be having a Q&A section at the end of the webinar. Now, these are the objectives of the session for today. We are going to be describing the fundamental components that makes up program project abstracts. I would like to remind us, I'm sure that we have not forgotten, that last time we spoke about science and a research abstract. But today, some of us probably might not have conducted research, but because of the place where we work and the kind of jobs that we do, we are involved in programs or projects. So many of my colleagues have asked that how do we get this out when it comes to sending it for a conference abstract and making our presentation. So we'll be talking about the fundamental components that make up a program or project abstract. We'll also be looking at frequent errors and misconceptions in writing program abstracts. And we are going to learn how to develop, how to write clear, concise, and compelling program abstracts. Now, it's the same whether it's a research abstract or an abstract that is based on program or projects. So it's the summary of the paper, summary of the work that you have done, summary of the program that you have carried out, summary of your projects, or summary of a group of activities that you have laid your hands on. So, and it's provide a brief summary of each of the section of the paper, whether you have written out the full paper or you are just starting with your abstracts. So this is the summary of whatever job or work that has been done. And it states the principal objective and scope of the study or the investigation or the activity. I call it study because some may be in form of study and some might just be in form of investigation or activities that you have carried out. Now, it's also described the methods that has been used or the pattern or description of what was done. It summarizes the findings or the results and it states the main conclusion. Now, the components of an abstract that was written out of a research work and the component of an abstract written as a result of a programs or projects or activity, they are almost essentially the same, aside from the semantics and aside from what is applicable. And that's what we'll be looking at as we continue. Now, still talking about the usefulness of writing abstracts or of an abstract, it showcases the beauty of the work that we have done. And it also allows the readers who may be interested in a longer work. That's when the work is eventually published. And it is published as an abstract, maybe in the book of abstracts or abstract section of a publication. So it allows the reader to know what they're interested in and to focus their reading. Now, after reading the abstract, the reader can make an informed judgment about whether he wants to explore more working relationship, or even they may decide on whether they should come to your session during your conference presentation, whether it is abstract or poster. And it also allows potential collaborators to identify the sessions that they need to listen to, and they can also preempt what the author has to say during the conference. Now, going back to the features of a good abstract, we mentioned this also for research abstracts. The title is usually informative, and it contains the words, what you have done, and most importantly, where the work has been carried out. Most conferences, as we have mentioned earlier, the word length for the abstract is about 200 to 350 words, depending on the type of conference that you intend to attend. Written according to the requirement of the target conference, or if you are not writing for a conference that we are targeting today, you may be writing to get your work published in a particular journal. So if you are doing that, it is almost still the same. The abstract has to be according to the conference where you want to make your presentation, or according to the journal that you want to submit your paper to. And let's remember that abstracts are written in past tense because the work you are presenting has been done already. And abbreviations, when used, must be defined at first mention, just like the research abstracts as well. Now, you don't need to cite references in the abstract, but if you have to, because some of the journals, they may want you to cite. So you need to be familiar with the instructions that the conference organizers or the journal you are submitting to have already indicated. Now, you should never give information or conclusion that is not stated in the paper or in the figures, or figures not quoted in the main text. So you must make or endeavor that whatever you want to conclude on is actually what you found in the study that you have done. Keywords are also very important in our abstracts. Now, this is showing us the differences between a conference, between a program or project abstract and a core research. Last time we dwelled on core research, but today, as I said, we are going to be focusing on program or project abstracts. Now, instead of having a background, or just like the background in the core research, for program or project, you have introduction or your background or context. They are the same. It's either it is the context, the introduction, or the background. Now, you have methods in the core research, but for project abstract, it's usually description of what you have done. You give a description, and it's just like the method section of a research abstract. Now, instead of having a research section, most often what we have here is lessons learned, the findings, what you can find from the study or from the project that you have carried out. Now, the conclusion is still the same. And instead of having maybe your recommendation, you may put next steps. So we're going to be talking briefly now about each of these that I've already mentioned: the introduction, the description, the lessons learned, conclusion, and the next step. Now, before we go to all this, starting from the introduction, it's good for us to talk briefly about the title of the abstract. A good title is defined as the fewest possible words that adequately describe the contents of the paper, whether it is a research abstract or whether it is from a program or a project that you have carried out or a group of activities. Ensure that you put the fewest possible words as possible. And the title is also important, and it must be written clearly. It must be well crafted. If it is not written clearly, then your audience may not be able to capture exactly what you have done. And improperly titled paper will definitely get lost, will never be read. And also, if it is not properly titled, the conference organizers may not want to accept your abstract for publication. So you need to craft the title appropriately, use fewest words as possible so that the conference will find it appealing, they will find it interesting, and then they will be able to invite you to come and present your paper and what you have. Now, the title should neither be too short nor too long as to be meaningless. When you are writing too long, it makes it meaningless. And I want to also inform you that concise writing succinctly, precisely, precise writing is something that one needs to learn over and over. It is easier to write longer than shorter. I'm sure that most of us have that experience. It is easier to put down your thoughts in 3, 4, 5 paragraphs, but when it comes to maintaining the content, maintaining what you have written, summarizing it concisely, writing it in few sentences, it is usually more work to do. Now, we should not use waste words that will not add to the title of the work or to the meaning of the title. And it should contain the keywords that reflect the contents of the paper as well. Title should be meaningful and it must not be general. Concise, specific, and informative. These are very important words that must be considered when you are crafting your title. And it must also capture the fundamental nature of the findings as well. Now, how do we craft the title of our abstracts? When we have done our program or project and you want to submit your abstract, you want to write it up for publication or to a conference, as the title indicates, make a list of the most important keywords. Think of a title that contains these keywords without losing any meaning. Once you do this, you must also ensure that the title could state the conclusion of the paper. The title never contains abbreviations. As much as possible, try to move away from abbreviations in your title. If you have done your work about, for instance, patient living with HIV/AIDS, in the title, try to write it in full. If you have worked using chemical formulas, proprietary name, don't put it in the title. Review your title over and over before submission and ensure that there is no grammatical error or the use of faulty word order in your title. When it comes to faulty word order, I mean repeating words, using words that are not properly arranged. And we are going to have an example of a title, sample type, project title. It's lessons from the design and rollout of an electronic medical record system for cervical cancer screening in Rwanda. If you look carefully at the instructions or guidance that I provided earlier, you'll be able to notice that this title is actually succinct, is precise, and it contains, merely looking at the title, you can preempt the contents of the abstract. Lessons from the design and rollout of an electronic medical record system for cervical cancer screening in Rwanda. Now, some may want to add, a study done. This should not be added. It's really not necessary. Some may be looking at learning from the experiences of maybe medical doctors on the design and rollouts. Now, when you are writing lessons from and you are putting the experiences, more like tautology. Assuming you want to remove the word lessons, you can go directly by using experience from the design. So try to ensure that the words you are using, they are not words that are repeated, and try to use the shortest as possible. Now, if you count the number of words in this title, it is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Now, most times when you are crafting your title, try to use words maybe less than 20, less than 22. Even most of the academic institutions, they have the required number of words when you are writing your abstract and you want to title your work. So let's stick to the shorter number of words as much as possible. Now, going to the introduction or background. Now, you know, in the normal paper, in the research article, you have introduction or background, but occasionally for conferences calling for abstracts from projects or programs, the background may be replaced with context, the word context. If you say, okay, the context, you are still talking about the background or the introduction. When it comes to conference abstract or presentation, you are still talking about the same thing. Just like a research abstract, the background or the context should not be more than 10 to 15% of the entire abstract length. And you must provide a context for the program or project. You must also be able to tell us the problem that, what problems did you identify? The problems that led to the designing of the program or the project. What exact problem do you have? Maybe, okay, in the community where I am, like health educators, they are very few. Maybe people that are going to the health centers. Okay, maybe some people decide not to go to the health center because they don't have people that can influence or mobilize or encourage them. And because of this, you trained like maybe 10 people in the community who are like influencers. People know them very well. After training them, you now told them that once in a week, they should go ahead, go to the community, talk to probably 10 people. Now, what problems did you identify? People are not coming to the health facility as they should. That may be the reason why you have started the program or the projects. Now, you should be able to tell us the problem in the context. And why is it important to talk about this issue now? These are very important. And what did the program or projects aim to achieve? You must be able to add it to the context. By the time you put the problem, why is it important to talk about the issue now? And what you aim to achieve, by the time you put all this together, you have a good background, like a good context for your study. Just like I said earlier, in core research abstracts, is usually background or introduction, but for program or project abstracts, it can be called context. And I've already mentioned what should be in the context, what led to the design, the problem, and why are you talking about the issue now? Why is it important? This is like the justification in the research abstract. And what did the program, what did the project or program aim to achieve? That is like the objective. So the first is the problem. No, the third bullet is talking about the problem statements in core research. The next important, why is it important to talk about it now, is just like the justification. And the last, what did the project or program aim to achieve? This is talking about the objectives. So let's note this. They are very important in the context of your project or program abstract. And mind you, most conferences, as I said, apart from accepting abstract from research, core research work, most conferences also want to know about programs or projects that you have used, maybe by organization or individually, to influence the lives of the community, so that people can learn from this and they can decide whether to replicate or to do something similar. This is a sampled project background. I gave us earlier the title of a particular project that was carried out in Rwanda. So this is the sample background. And let's look through and see whether those items and points that I've noted, whether they are reflecting in this or not. Now, in its commitment, you can read this yourself as well. In its commitment to delivering comprehensive women's cancer early detection services, women's cancer early detection services, the Rwanda Ministry of Health rolled out a new cervical cancer screening program. The paper-based medical record system that tracked clients at different points in the continuum of cervical cancer care had challenges with storing data, assessing clients' information for follow-up visits, and fragmenting information on individual clients. To support the rollout of the new cervical cancer screening program, a new electronic medical record system was designed and implemented to ensure clients were followed along the complete continuum of care. We document the development and implementation of the electronic medical record system and highlight challenges, lessons learned during implementation. Now, if you want to look at this context or background properly, it asks what's the problem. The problem is talking about people record are missing, some records are not seen, women are not coming for the program, and so on. So in its commitment to delivering comprehensive women's cancer early detection services, the Rwanda Ministry of Health rolled out a new cervical cancer screening program. So it is also good you mentioned maybe where the study or where the activity or the project was carried out. So this is a paper-based medical record system that tracks this and that. Now, what is the program aiming to achieve? They want to support the rollout of new cervical cancer screening program. So if you look carefully, you notice that all the three most important things that I mentioned in my previous slide, I will go back to the previous slide for us to know. Now, I said, what problems did you identify which led to designing the project? Why is it important to talk about it now? Because they want to start a new cervical screening program. And what do the project or the program aim to achieve? They want to increase retention and so on and so forth. So ensure that you put all this together. If you look at this, some of us, we have done one program or the other that we can actually put together and send to conferences, calling for abstracts and present and project our organizations. People know what we have done, and then we are able to share what we have done with others. People can learn from our experiences. Science is about sharing knowledge. Conference attendance is about sharing knowledge, learning from others. Now, going to the description or the intervention of the implementation, that's more like the steps. What are the practical steps that you took in ensuring that the work was done? Now, in a full research abstract, this is just like the methods. But in a project or program abstract, they call it description of what was done, or the description or the intervention that you put in place, or how the implementation was done. And usually it contains about 60 to 90 words when you are targeting writing about 300 words abstract. This should be almost 1/3, like 35 to 40% of the total abstract length. The description of what you've done, you must give considerable number of words and attention to the description of what you have done. And it includes the who, where, what, and when. Who did the project? Where was it done? What exactly was done? And when was it done? And when doesn't necessarily mean the time. When does not necessarily mean the study was done between January to March 2024. No. When means probably what period of the project. When could mean at a time that zero dose immunization increased, or people are not patronizing the healthcare facility. At a time when mpox prevalence increased in Nigeria, that could be the when. So I'm trying to emphasize the fact that your when does not necessarily mean time that putting it in, oh, September to December 2023. No, you can describe when the project was done. Probably at the beginning of the rainy season, when the prevalence of cholera is usually higher. That can suffice as well. It may also include the innovation, the intervention, or the training if you have done one. If you have introduced an innovative method to solve a particular problem, it's good you introduce it and you add it to your description. If you have introduced like an intervention, probably you carried out like an enhanced health education program in a particular location. And usually what they do is to just distribute probably IEC materials, information, education, communication materials to people. But in a particular location, just say that at a periodic interval, I'll be sending out my staff to go and educate the community. Maybe training was done for a particular group of people. So these are the things that you need to include. And you must know that it is important to include who the trainers were, if trainings were done. Length of the trainings, if trainings were done. Number of participants. Oh, we trained 40 immunization influencers and so on. And who were the participants and people trained and what was the focus? All these are very important parts of the description of what you have carried out of your projects or your program. Now, after the description, we move to lessons learned or the findings. Lessons learned usually contain about 80 to 90 words, which is like 35 to 40% of the total abstract length. Now, I told you that this description should also be about 1/3, like 35, 30%, 40% thereabouts. Likewise, the lessons learned or the findings So the two most important parts of your abstract, they are the methods, which is the description in this case, and also the results, which is the findings or lessons learned in this case. Then the remaining part, the conclusion and the context or the background, they can share maybe 10% each if your description is about 35 to 40 and your lessons learned is about 35 to 40. So lessons learned or findings should match the objectives stated in the introduction or the background of the study. So the objective that I have stated, you should ensure that your lessons learned or findings should match this objective. And it should also be measurable. If data is available, if you are using data, oh, we trained 20 facilitators, we trained 20 influencers. Now, if you have trained 20 people, you should be able to tell us how many females, how many males. I think that is very important. If you have trained people, where were they trained? So anything that is measurable, you should try to put it. Even though this is not like a full research work, it is not like a quantitative thing that you want to be measuring 20% of this, we're taking this, 10% of this, but it's still good you give us the description of the people that are involved or any variable that is measurable. The measure of success metrics must have been developed. Yes, this is very important. When you want to carry out an activity, you should be able to tell us how are you going to measure success at the end of the day. You must be able to add, oh, by the time we have done this, maybe whoever has probably practiced hand washing, maybe 3 out of 4 times, that person is said to have had good hand washing practice. So you must put metrics there like that. Anything you want to measure, try to ensure that at the start, tell us how you want to measure success so that it doesn't sound as if you change the goalposts in the middle of the match. Failure to achieve the project desired outcome does not mean lessons learned are not worth sharing. Most times when we carry out a project or activity, we always want the project or activity to lead to a tangible outcome, to have a positive outcome. But sometimes it doesn't happen that way. When the outcome is not positive or is not tangible, let's still endeavor to ensure that we share our findings. Let's still endeavor. So I participated in a research work carried out in Ondo State some few years back. And we noticed that there was like a profound difference. We carried out the study in 2 different communities, and we noticed profound differences in the 2 communities. And I told the people that we are doing the research together, especially the person that was like the supervisor, that we noticed some differences, and we're worried about sharing our findings. Say yes, that is important, that we should share our findings, like let people know that this was what we found, and this was the reason behind it. So objectivity should also be maintained. Now, this is a sample project lesson learned, the same study that we went through the title. So this is the lessons learned, like the results, the findings of that particular project. Let's read together. It says cervical cancer screening or screening sites are currently using the electronic medical record system to conduct clients' information and track women along the continuum of care to reduce loss to follow-up. The system has been rolled out to all newly activated screening sites as part of national scale-up. So that was the findings of this particular project, medical record system to document clients' information and track women along the continuum of care to reduce loss to follow-up. That was achieved. The system has been rolled out to all newly activated screening sites as part of the national scale-up. Now, you know what? This is a very simple result telling us what they plan to do. Most of the time, as part of the projects we do a lot of activities that usually go unreported, undocumented, and were never presented. And people won't get to know. This particular abstract was taken from a publication from Global Health Science and Practice. And the reference to the publication is at the end of the presentation. And you also find the link. I think the link was on the type 2 page as well. So you can look at this and go back to the study, read it. It was like a simple thing to me, but they got it done. They documented what they found, and they were able to publish it and discuss it with other stakeholders and share with us. And we're also learning from it today as well. Now, going to the conclusion. or the next step is the same word. We call it conclusion in research abstracts also. But most times, some journals or just some conferences, they might want I want you to call it next steps. Now, this accounts for just about 10% to 15% of the entire abstract length. And do not leave the interpretation to readers. What you found, what you reported as the finding, you need to interpret it in your conclusion. And you need to draw your conclusions logically, just like the research abstract too. And oftentimes, it is good for you to add your recommendation or the policy implication. This result that I found, what does it mean? What is the policy implication? What do I do with this? So let's all try to put that. Now, this is the sample from the project, from the topic that we are looking at. Planning, collaboration, and adaptability were the key factors in these systems successfully rolled out and should be the foundation of future data system development. Let's look at this conclusion again. Planning, collaboration, and adaptability were the key factors in this system successful rollout. That was like the conclusion. Now, like the next step or the way forward, this should be the foundation of future data systems development. That is, whoever is developing data systems elsewhere, they should ensure that they plan adequately, they involve as many stakeholders as possible, and they use something that is adaptable, something that others, maybe they have seen others using it with some success, or something that they also want others to adapt. So this is the conclusion of the same project that we have been using as our example for today. Now, what are the take-home points? Always endeavor to read instructions provided by the conference organizers. So it's like you want to do an exams and you have been given the marking scheme and they told you that, oh, this is the marking scheme. And you look at the marking scheme, you read it, and when you are writing your exams, just put it down the same way you read it before the exams in the marking scheme. If you now decide that, no, I want to write something different from what we have on the marking scheme, then the examiner may not be able to mark you properly or give you the necessary grade that you are supposed to get. So read instructions provided by the conference organizers adequately and give adequate time to writing. Go back to the proposal. Go back to what you have planned, to the planning stage. Look at it over and over again. Read examples of abstracts from well-known journals, from conferences. And I said earlier on, I'm not trying to publicize any specific journal, but when you want to look at project abstracts, I will advise you to go to Global Health Science and Practice. So any project you do, I think I've also published a project abstract there in the past. So go to the journal, read and read. You will see a lot of projects, public health projects that have been carried out, especially in low and middle income country, and ask for peers to review and revise as required. Revision cannot be overemphasized when it comes to writing, not only abstracts, any writing at all. I wrote one of my colleagues wrote something recently and posted it. And at the end of the day, there was a little mistake there. It was almost getting late before another colleague pointed attention to what the other colleague wrote. So it is good for you to share what you have written with others. Let them look at it over and over again so that you don't make mistakes. Do not add a reference list or in-text citations except if it has been requested for by the conference organizers or by the journal where you want to send your project abstracts. So do not report results that do not speak to the stated objectives. Do not write in future or present tense because your work has been done. You need to write it in past tense. And result that does not speak, at times when you carry out your study or when you have done a program or projects, you have a lot of things that you have found. Maybe when you got to a community where you're expected to carry out your projects, you had some delays because the community members probably they did not cooperate with you. Intentionally, that is actually not really intentional part of your work. But at the end of the day, you may even want to write that out, how to handle stakeholders when it comes to some community projects. Probably you had some tough time handling the community members. Maybe you now had to use some very important and intelligent method, so that you want others to learn from the methods, then you want to publish it. Now you need to craft your objective to speak to that part, and then you write that part out and you get it out. So do not conclude your abstract using information that cannot be garnished from the findings of your abstract, from the results, from what you have found. Do not conclude on information that cannot be gathered from what you have done. So ensure that everything is well tailored, from the context to the description to the findings and also to the conclusion. So I want to thank you and appreciate you for attending this brief webinar today. So this is actually the reference to the article that I used part of the abstract for illustration purpose. So you can take it up and read. You can also read more articles from that for particular journal. I'm sure that you will learn a lot from that as well. So thank you so much for your attention. I will now have to hand over back to the moderator of the section. Back to you, Ms.
Thank
Anita.
you very much, Dr. Elisami, for that insightful session. Okay, we'll be taking a couple of questions. Dr. Nuruddin, please unmute and ask your question.
Okay. Good morning, colleagues. Good morning, everyone. Thank you very much, Professor Elisami, for this weekly insight. My sincere appreciation and gratitude to you. This is, in fact, an eye-opener again for me. So when I was going through the caution slide, I never knew until this morning that, we should not add references until we are asked, to do so. I've written supported a couple of abstracts that even if they didn't ask, we used to hide it over there, the references. That's fine. Thank you very much for that. I want to ask now that you did not mention in that slide, the question slide, asking whether we can add acknowledgements, or not in terms of supporting partners, that support that project. For example, let me say health information management or health informatics, supported by AFENET, MPA, CDA, NCDC. Are we allowed, to write, to acknowledge our supporting partner? That's one. Then number two, the keywords, in abstract writing, are we also allowed to state, the keywords, in our abstract, the first keyword, second keyword, and the third keyword? So that will have for now. Thank you, and over to you. Thank you very much, sir.
All right, Dr. Elisami, would you like to take the response now?
Okay, thank you so much for the question, Nuruddin. I'm glad you were able to attend, and I'm happy and excited that you're pleased to learn one thing from this. Now, do we need to add acknowledgements to our abstract? Now, for the purpose of a conference abstract or even an abstract that you are writing as part of your research work you want to publish, you don't need to write acknowledgements. But in the body of the presentation, or if it is a manuscript, in the body of the manuscript, there is usually acknowledgement section. Now, what you can do in the abstract of a project or program is to mention in the description, if it is necessary, just like the one we looked at, the Ministry of Health, Rwanda, and so on. So the description section, you can mention the partners that you work together. If maybe training was facilitated by colleagues from Africa Field Epidemiology and Laboratory Training Program, epidemiology program, that's one. Then the material to use was maybe designed from materials from National Primary Healthcare Development Agency. I'm just using that as an example. You can mention them, but when it comes to acknowledgement, try to put that in the main presentation or in the body of the manuscripts. Now, keywords are very important, please. If the conference organizers, even if they don't ask, most times, if you are submitting your abstract through online platform, they normally make provision for that already. But whether they actually make provision for it or not, ensure that you add your keywords. Thank you very much. Back to you, moderator.
All right, sir. Thank you so much. Okay, so we have a question from Dr. Mitoyi. And it says, I would like to ask if someone does a project and does not have a full paper, but is writing the abstract just for the conference, how does the person draw conclusions? Since you mentioned that we should not put things that are not in the full paper in the abstract. Did you get the question, sir?
Yeah, thank you once again, Dr. Mitoyin. Now, I think I said, well, that was exactly what I said. But I meant to say that whatever is not in the results of the abstract, don't add it to your conclusion, not the result of the full paper. Most of us, when we write our abstracts, we probably have not even worked on the full paper. And I mentioned the last time that I always try to have my draft manuscripts before sending my abstracts out. That has actually been my practice. Or maybe the people that mentored me when I was still learning and I was still very good, that was the way, because my first conference presentation, I said last time, that was just like when I was doing my residency, and one of my senior colleagues that I'm very grateful to up to today told me that we went for an outreach and we collected some data. And I said, okay, go and enter the data in SPSS. And now I never had SPSS on my system. I had to go and learn within 1 or 2 days how to enter data on SPSS. I finished entering data. I told them I've entered this. Hey, you analyze and come and show us the findings. Oh, I said this. I was wondering, how did I even attend this outreach with them and so on? Not knowing that they were trying to make a research out of me. I went ahead, I did this and that. I analyzed, I finished analyzing. They said, hey, go and write a draft. There's a conference coming up very soon. If you are interested, you can send it to me. So I wrote a draft and then I crafted the abstracts. They kept on guiding me, like putting my hands on the paper, how to write and so on. So what I think I will advise is that what I should have said rather is that anything that does not come up in the results of your abstract, don't add it to your conclusion. Don't make room for any surprises. Don't create any new thing. Thank you once again, Dr. Omitoyin. Back to you, moderator.
Okay. Before we take Dr. Ajuma's and Dr. Amo's comments or question, there was a question we carried over last week. So I don't know if you would want to attend to the question now. So the participant was asking about salami slicing. That how I think you remember the question. The participant was asking that how does one conduct multiple level of analysis or different analysis on a robust data set without actually slicing or over slicing the results into bits that are like repetitions? That's the question.
Thank you very much. What I was trying to actually explain then was that when you carry out a study, you can actually publish more than one paper, or you can present in more than one conferences from a particular work that was done. Now, someone asked a question before then that the same abstract that has been presented in maybe conference of epidemiology, can I present it in conference of microbiologist and then conference of public health physician and so on and so forth? And I said no. However, you can still present another part of the work. Now, the example I gave last time was that if the study was done in a particular, maybe you have done a study whereby you compare rural and urban population in a particular outcome, that it may be possible for you, if you notice that collapsing the work together, we lose some maybe ingredients or some very important finding, you can do the rural component separately and give recommendation, and do the urban component separately. Not as if you are slicing. It is not the same population. Probably you study 300 people in the rural area, 300 people in the urban area. That's enough to make up a small study on its own. Rather than if you present the 600 together and you lose some part of the work. So now, before you also represent any part of any work, ensure that there is a new objective. There is something else to contribute to knowledge. For instance, if you have gone to a particular community to carry out a training, it's something that I did. We trained some members of the community on how to prevent Lassa fever. And let's assume that in the community, we had issues with some members of the community who probably felt they don't really need intervention and what we wanted to do. Now, I can write again on how to guide scientists on probably community entry in carrying out field work. That was not part of my objective. My objective was to know whether the health education program was going to have any effects on the community members. That was what I intended to do. But I can craft another objective. So anytime you want to do or write another abstract from the same work, ensure that the objective is new, you are adding something new, and you are not just licensing. It's not that you have carried out the study in a community and you felt that, oh, I want to go to the conference. Let me present female section separately, male section. If slicing it into male, female, it's not going to add anything to knowledge. So I think we should ensure that we don't do that. And I think that is a very meaningful and interesting addition by the moderator on the chat box. And it says that salami slicing is a term that is used to describe the practice of dividing a single research study into multiple publications. This is done to increase the number of papers published by a researcher. Salami slicing is considered unethical, so and so on. So you can go through the remaining parts so that we save some time. Thank you, moderator, for adding that. So back to you, please.
All right, sir. Thank you so much, sir. We'll take Dr. Ajuma's question, after which we'll proceed with Dr. Amao. Dr. Ajuma, please unmute and speak.
All right, thank you so much and good morning. I think we are having a very insightful section and I appreciate the facilitator. I just have a few questions to ask. One is, I've seen many persons present proposed projects and I've seen present ongoing projects. And this presents another specific dimension to abstract writing. So now I am asking. Hello, can you hear me?
Sorry, the moderator can mute people that are joining me.
Okay.
My hypothesis was wrong. The shotgun can't hear the thunder. So it must be the lightning that's making things flash.
Okay, please continue.
Hello, can you hear me?
Yes, please
Yes.
proceed.
Okay. Yeah, I've seen many persons, authors present proposed works, and I've seen some present ongoing projects. And this presents a unique dimension to abstract writing. So I'm asking if abstract must always be written in past tense. How do you put it in an ongoing project or proposed project? Or is it that it is not recommended that ongoing projects or proposed projects should be presented in conferences? And then again, there's also something that I do notice specifically, and changing dimensions, changing trends, and all that has displaced a lot of things. And I start seeing professional scientists talking about the title of every writing. And some persons, some scholars argued that it is not professional for you to use words like the impact of that, or the effect of that. It is tautological, it is already revealing what is in the work. And some persons argue otherwise. So I just need clarification on this. Thank you.
Thank you so much for the questions. Now, about your first question, I want to say that by the time you want to write part of your work, you have already done that part. So it still has to be past tense. except the proposal. Now, let's assume that I want to carry out like a project in probably in Nasarawa State. I've selected schools, maybe like 200 schools. I don't know whether they have that number of secondary schools anyways. So I've selected 200 schools, and these schools, I want to carry out an intervention to improve hand washing. So the first stage of the project is to distribute hand washing commodities, maybe bowl, this and that. Now, after getting to the school, I now notice that some of the schools, they already have what I plan to distribute. And the stage of distribution, let's assume that is the first phase of the project. The second phase of the project is to go around and see how they are using the items that you have distributed. And maybe the third stage of the project is to see how they are able to evaluate whether it has led to reduction in diseases that are due to poor hand washing practices, maybe cholera, maybe reduction in fecal-orally transmitted infections and the like. Maybe that's the third phase. Now I've divided the projects into 3 phases already. The first phase is to distribute with the items that they will use. Now, at the end of distribution, the study has not been completed, or the project to say is not complete yet. But at that point, I can go ahead and write it out and still present it in a conference. But that stage is talking about the distribution. So it's not a complete project at that point. Maybe uptake of distributed items to facilitate hand washing among schools in Nasarawa State. And I write it out, I describe it, I give the lessons, I put the conclusion and so on. So that part has already been done. And if something has been done, it has to be past tense. So that's why your abstract must be written in past tense. Now, you mentioned some words like impact, effect of, assessment of, evaluation of. Well, when it comes to making your abstract succinct, making it precise, it is good for you to run away from all these words, because they add maybe unnecessary words, they call them, in some titles. Now, I've seen some authors who are actually senior scientists that I also learned from. They use it. I think in time past, the trend was in support of that. But now it is in support of making it succinct, precise. You don't need to put a study of commercial transporters in Kogi State. Whether you call it a study, it is still a study. An assessment of, you can put that in your methods so that you make it succinct. You can just say, okay, road traffic, this, and so on. But when it is compulsory, you must put it. And how do you know when it is compulsory? Probably that word is actually part of what was actually done. Do you understand? If it was part of what was done, then you must add it. So thank you very much. Back to you, moderator.
All right, sir. Dr. Amo, please unmute and ask your question.
Thank you very much, Dr. Ilesami and Dr. Anuluakbo, for the opportunity to be part of this interesting learning gathering. So my first question is that I want to know the ethical aspect around publishing, or let me say presenting an abstract. For example, for those of us that work in the biosafety space of the laboratory, we have oftentimes carried out trainings in different communities, training laboratory personnel on biosafety practices and things like that. And we have data. So in such cases, when trying to present such data for abstract, so who are we compulsorily supposed to give that kind of acknowledgement to, that will not lead to any kind of ethical rule flauntation and all that? That's my first question. Then second question is with regards to the first question that I asked about proposal. The person emphasized that he has seen some people, presenting proposals in conferences and all that. And I think that question was skipped, and I'm also interested in it. Thank you.
Okay, thank you very much. Yeah, it is true that some conferences accept proposal. Now, if the conference accepts proposal, then that is actually when you can write your proposal in past, in current, in present, or future tense. If the conference is accepting proposal and you are sure that, okay, maybe work in progress or work that you plan to do can still be submitted, then you can go ahead and write it in present or future tense. So that is if it is announced. So that is allowed. One thing that is very important is that you need to stick to the instruction of the conference organizers. If they say that you should not call it introduction or background, call it contest, then you call it contest. If they say that call it this, whatever they have mentioned, or you ensure that you stick to the instructions. Now, going to ethics, ethics in research, it's actually a very broad topic that we cannot overemphasize. If you are working in the lab and you have some data, you have some results that you want to use, I will advise you that it is good. That is actually not just like a program anymore. It is tending towards more of a research work. Then you need ethical approval to be able to carry out that. Now, let's assume that you have ethical approval. There is also a place of consent of people. Now, if I have a project with maybe Nigeria Institute of Medical Research, if I work as a laboratorian with them and I've analyzed some data for them in their laboratory, probably being a staff or I'm attached to their laboratory, it is still good for me to get ethical approval for my work, and I must inform my superiors. I must seek their consent that, oh, I intend to do this. I'm thinking of looking at this. Let's assume that it was actually part of their major work, and you have analyzed results and you have sent it out, whereas they are still looking for something. They need to know some things. Probably the result that was sent to you were even placebo. They are not the main sample. They just want to use it as control and so on. So you need to carry them along. You need to ensure that aside from getting ethical approval, you seek consent of those who participate or those who should be in the study. And apart from that, there is also a place of acknowledging people who are part of the study or who are part of the work. All this, I think ethics is something that we cannot just finish talking about in a few minutes. There is a place of consent, a place of permission, a place of ethical approval, and so on. So thank you so much. Moderator, over.
All right, sir. There is a comment from Dr. Modupe. Thank you very much, Dr. Ilesomi. Okay. She's saying, do you have any active mentoring community one can join? She says she sits on data and she knows she has a lot to offer in terms of sharing new knowledge and contributing to the robust information that has already been published.
Okay, thank you so much. I think, well, depending on where you practice and work, you can also set up a research group, a private research group. You can set it up. Maybe you have data sets, you produce a lot of data, you turn out a lot of data, and then you have not been using it. You can look for someone who is vast, or maybe in your place of work or in your circle of influence, you have someone that can do data analysis. I did that recently. I could analyze data. I learned I started by being a data analyst at some point in my career. But at some point, I had too much to do. Then I had to give data to some people, okay, analyze, share with me, let's see what it is, and so on. So you can set up a team of people that are willing to learn and willing to contribute. You can share the data with someone to do the analysis. In that team, another person can do the first draft of the results. Another member of the team can also write other part of the work, and you put it together. So you can do that. And if you think that you don't have what it takes to set up a team and lead, I think it's good for you to look for a team of researchers or identify someone with superior knowledge or someone like a mentor that you can attach yourself to, continue to learn, and as you are learning, share what you have, and then you can put it together. And you can even look at the data yourself, try to analyze one, and by the time you start something, invite others to collaborate. Where I think you should start with is to share your intention with other colleagues that are like-minded. Now, this is one thing that I've noticed when it comes to working collaboratively. A lot of people want to be part of your work. They want to be a co-author, but they don't want to contribute their time. They don't want to contribute their knowledge. They just want to show their interest, and they want their interest to translate. So there is a lot of things to also learn in becoming a co-author of a paper, becoming part of the work, all those things. It has its own ethics as well. If you have not contributed, you don't merit being one of the authors in the real sense. So we can talk more about that. I'm sure that I may be able to provide more guidance on how to go about that. Thank you so much. Over.
All right, sir. Dr. Karim. So while we are waiting Dr. Karim's question, Dr. Nuruddin is saying, can more than one author physically present a paper during the conference? So I'd like you to respond to this jointly with the response to Dr. Karim's question. Dr. Karim, over.
Thank you very much for the recognition. Thank you very much, Prof, for this very enlightening and motivating presentation. My question is, okay, I have two questions. Basically, the first is on the issue of the salami slicing. I think it's been a very controversial term. Now, usually, when somebody does a dissertation that will spend almost 4 to get a part 2 dissertation, one has done mixed study, you have committed almost 3-4 years, one now becomes a fellow, and then one will now write just one abstract from that particular hundreds of pages of work. So this is how I look at it, that it looks like one has not really justified the medical community with enough publications on all those efforts. So my question is, what is the permissible one? I've looked at it in three forms. What you have explained now is talking about, maybe from what I got, the samples. Maybe we'll use a sampling from a particular location for one paper, then another sample participants from that same study for another publication, which is not slicing. But I want to ask that in a case when somebody has done a mixed study, now publishing the qualitative aspects as a paper and the quantitative as one, or I've looked at depression, cognitive impairment, and quality of life among, let me say, older adults with chronic medical conditions. So if I publish depression among older adults, cognitive impairment among them, and quality among them, or I've looked at people that have hypertension, people that have DM, people that have arthritis, and I publish DM in depression in hypertension, depression in diabetes, and are those things, are they also salami slicing, or they are trying to trying to make sure you feed the academic community with as much information as you have, which you wouldn't be able to done with just a single publication. So that's one. Then the second one, I know that as resident doctors during residency, we used to have a lot of presentation. At least during my residency training, I think I had about 50 PowerPoint presentations. In my center, I would present almost every day. So when I finished, I saw somebody who in a particular ALD lecture, he was talking about how he got to be appointed, I think as a senior lecturer or so, because almost all those PowerPoint that he has presented, he found a way of writing them as abstracts, and then even was able to even write some of them up to full-blown articles. And then, so I'm now going to ask, how can somebody convert some of these our regular seminar presentations to maybe narrative reviews, or at least for those who are in residency, so that they don't just lose all those efforts they have put into presentations? And thank you very much, sir.
Yeah, thank you, Dr. Karim. I'm happy you're able to join. Now, let me start from your last question. You know, as you said, as residents, we did a lot, but it's good that you are bringing this out. some of the presentations that we did, we normally go through a lot of literature reviews. We go through several other work. We present findings. Even there was a time I did a presentation as a resident doctor. We had to go to the record section of the hospital to make some inquiry. We went to the admin. It's more like a mini study in a way. So when you're able to do some of these things, I think it is good for you to get it published. It can be like an opinion paper. Now, one thing I also want us to learn is that when you are publishing your first manuscript, some are very fortunate and they worked for it and they got it. You should not be targeting BMC Public Health or maybe a Q1 journal or Lancet or thereabouts. Now, I happen to be an editor of the Journal of Association of Resident Doctor when I was a resident. I encouraged a lot of my colleagues to publish. And I told them that you can publish what is even not a full paper. You can publish opinion. You can publish other things. Maybe you can be invited to write an editorial on something that is topical and so on and so forth. So you can write you can write an addendum. You can even read somebody's paper and write a letter to the editor as a response of that paper that you have read. Now, one of my first few publications, there was another colleague read that paper. It was Odette Economics, cost of care among hypertensive patients and the like. And the person added in his own write-up that I did not factor in all the indirect costs. That the people that are coming to the hospital, I should have looked at the kind of jobs that they do. Some of them that are artisan, they come to the hospital like once in a month and they spend almost 2-3 hours from the time they left their house till when they probably left the hospital or go back to their place of work. That it's a very important part that I did not capture all the indirect costs fully. I learned from the paper myself. So we can also respond to others' work and still get that same active response published. So we should not downplay all the seminars, presentation that we have done. So let's take a look at that again so that our colleagues who are resident doctors can make the best use of the opportunities that they have. Now, the second question that you ask, you are talking about how many papers to publish. I think you've indirectly answered that question, but as a form of guide, you can use your objectives to decide on what to publish. Like for my own fellowship paper, I published 3. I had 3 publications from it because I had about 4 objectives. And I was able to craft it out in a way that there is even 2 of the sample size were not even the same. Extracted from the same study, but not the same sample size at all. One was my work was something on economics, cost of care. I looked at the effect of seeking healthcare on the population in a particular community. The fact that you seek healthcare, what is it? Is it depriving you from other things and the like? Then I think one of the paper factors associated with catastrophic cost of care and so on. So I can't remember the third topic specifically now. So we can use our objectives. And if you go with the objectives, you will definitely be able to publish more than one without slicing at all. Now, you can also consider geographic location. One thing I also tell people is that, are there questions that your study has answered that you have not been able to publish? If you look at your work, is this work answering questions that people have not seen, that you have not been able to tell people about? So if you look at these approaches in terms of answering questions, in terms of the objectives of your work, and also in terms of the location, geographical location, and even the intervention, you mentioned qualitative. Some study, even though it's qualitative and quantitative, it's not more than what you should publish together as one single paper. So being qualitative or qualitative may not really determine whether you can have more than one publications from it. But if you look at the objectives, and then if it is robust enough, that's why it's good for you to do something that is robust. I did MBA, and the best I could publish from the work was just a single paper. I couldn't have done any other thing beyond that. I published a single paper from it. So, and I said my fellowship, I did 3 for my fellowship. So depending on how robust your work is, you can decide without slicing. When you just publish, okay, something among female, and the same another paper manuscript, you want to publish something on female that are between the age of this and that, that is going to slice it. So thank you once again. The first question is, can we have more than one author in a particular no, that's not in a conference. Can more than one author present a paper? No, most conferences will only invite the presenting author. You don't need to be the first author, but whoever has been identified as the presenting author is the one that is usually invited to come and do the presentation. So maybe if it is a panel section in a conference, if you send your work and they look at it and they felt that, oh, this person should be able to participate in a panel session, they may write you that one of the other co-authors should attend. There was a publication we had last year, and a particular institution in South Africa saw the publication, and they sent a letter to me that they want us to feature in their, they want to critique the paper in their journal club, and they want at least 2 or 3 of the authors to be part of the journal club so that they can ask us questions, and we could also explain some other things that have policy implication about our work. And thankfully, I attended, and there was another colleague who was one of the co-authors. So 2 of us attended the session. So just like that, so you may be invited to conference, but ideally, usually the presenting author is the one that is invited to participate. Thank you so much for the questions once again.
All right, sir. So we'll take the last 2 questions. The first is from Dr. Njokwata, and it says, please, she works for a public health implementing organization where they help implement a couple of projects for global health organizations. Now she's asking, does writing an abstract on any of the projects we carry out count as a project or program work that can be accepted in conferences, as there is a lot of data and lessons to share? For example, a project on a market shaping exercise for HPV testing in 3 African countries, or validation studies of a novel PCR Lassa fever kit in Nigeria. Would this be valid studies to write on, especially from my position as an implementer? All these studies have ethical approval.
I would like to allow the moderator to answer this question this time around. Then I can make inputs. Please, over to you. Because she has done something like that over and over, and she has gotten some of them published and many of them presented in conferences. So over to you, moderator.
Okay, so I think part of what Dr. Elesome addressed earlier was that while it is ethical to write on the projects that have been conducted, one needs to ensure the buy-in and approval or permission from all the supervisors concerned with the work. As long as you had mentioned that the study had been approved, yes, but you were not an independent implementer. So every other person, even at the point of conceptualizing, writing it up, I think it can be discussed, the idea can be discussed among all the focal persons concerned, and then you may take the leadership on presenting or developing the drafts and sharing with them for their inputs so that it can proceed. But as long as it's important that, like we recorded here, that you have ethical approval, and that will help to expedite the actions required to complete the paper. But yes, you can write it up, but you won't write it in isolation so that it doesn't seem like plagiarism, or you have stolen other people's contribution and made yourself the only person who contributed. Over, sir.
Okay, thank you. I think the question is well answered. So you need to carry others along. That is very important. And each thing, whatever you are doing, it's what's presenting, it's what's sharing with others. Let people learn from what you are doing. That is actually one of the most important things in science. People learning, sharing knowledge, and so on. By the time you collect data and you don't share it, it's more like you have kept knowledge alone to yourself and you don't want others to learn from you. So thank you. I don't know if there is any other question.
Yes, so we'll take the last 2. I will read out the first, then Dr. Amo can unmute to ask his question. Okay. So the first question is, can we present results from implementation done like 10 years ago that were not published? So this is basically asking for the threshold of when to present a data set or results. Okay, Dr. Amo, over. Please ask your question.
Thank you very much. I'm sorry, I'll have to come again because I need to just make myself clear again. Okay, so what okay, let me put my question in context. Like sometimes ago, I received a small grant to train some laboratory professionals on biosafety practices in the laboratory. And we had some lessons learned from that particular program, myself and some other senior colleagues. So while we have data from the trainings with respect to how people were able to assimilate the knowledge and all that, that kind of a scenario, that kind of a project, how can one convert it to an abstract in real time? And I want to ask Prof. Ilusami if he doesn't mind if after answering the question, if it is possible, that I share when it is ready, that I share the draft with him, if you could help in, guiding us to perfect it. So that is my question. Thank you very much.
Okay. Yeah, thank you once again for your questions. I think the first one is, can we present results from implementation 10 years ago? Now, the answer is not a yes or no answer. But if you have carried out a project and it's like 10 years ago, I don't think the results is worth communicating anymore. However, that is not a no. Now, let's assume that the last time that we had monkeypox outbreak in Nigeria was some few years back. It's not the case anyways, some few years back. And you implemented a particular project that led to a reduction. Let's assume this was even 20 years ago. And now that we're having it again, you can still share that finding. So that is when something that you did years back can still be relevant. But now let's assume I did a study among secondary school students on how to encourage them to practice hand washing. And the project was a success. And now there is still a need to carry out the same projects. And I also want to learn, I want people to learn from that experience. Then that is an experience that can be shared again now, even though it was a long time ago that it happened. Fine. Now, if you are doing a study and it's something that is not really, or you carry out a project and what you found 10 years ago is not going to add anything to knowledge anymore, then you don't have to push it further. But if you are sure that this work has something meaningful, that people must learn about it, and so on, then it is good you still try your shots and send it to conferences. Even a few conferences, they will not ask you when the study was done, really. Whereas most will tell you that you must not send abstract of any work that was done more than maybe 2, 3, 4, 5 years ago. So what I think I would like you to learn is that try to share your work as soon as possible. It is always better that way. Now, you add some training, the last question. You add some intervention, you add some training, you train some people in the lab, and you did some projects. I think what I got from that, or what I would like to say, is that if you have done that, just like one of the questions that was answered previously, and you have ethical approval, you have done the study, you can go ahead and make your presentation or share it, submit it for conference presentation in a particular conference. Even though it is a real-time thing, that means you can't, if you are having a study done and the data collection is still ongoing, but wherever you stop, you can even say that results of, I'm not a laboratorian, but I'm just saying this, maybe result of incubation after 24 hours. Probably you are incubating a particular organism. You want to do the incubation for 3 days, for instance, for 72 hours. But you want to share the findings in the first 24 hours. What did you find? Then you continue your, it doesn't mean that the other results will not be collected and your work will be put together. But you can just share what you have found if there is something meaningful or something interesting for people to learn from. So once again, thank you. I'll be willing to advise or guide or support as much as possible. Thank you so much. Back to you, moderator.
Okay, sir. Thank you, thank you, thank you. Okay, for to respond to Dr. Ajuma's question or comments, we would communicate via mail, whatever it is we decide or we agree to do, whether it's to create a WhatsApp platform to facilitate learning and the rest. I'm sure we'll communicate. We have all the email addresses of everyone that registered for this webinar. So there is a platform already to communicate with us. So with this, do we have any other question? I do not think so. Okay. All right. So with this, we have come to the end of today's session. Again, today's webinar was sponsored by Plus-Circle Community Health Advancement Organization. You can follow us on LinkedIn and all other social media platforms. We would be communicating with us on the exciting session, which will be coming up next week, Saturday by 8 a.m. We will be doing 8 a.m. so that would take this learning opportunity before we start the day fully. And I believe that it's been an amazing experience so far. So with this, we're saying thank you to everyone who found it worthy to join today's session. And we hope to seeing you participate actively in future sessions. Please, as emphasized earlier, it's as emphasized earlier, it's important that we apply the knowledge on the go. As we learn, let's not keep the knowledge redundant. It makes more sense when we apply them immediately, and that way we can grow in exponential pattern. Thank you so much, everyone. It was nice having you. Thank you, and enjoy the rest of the day. Bye.
Bye. Thank you, moderator, for a good session. Bye.
Thank you. Bye.